I'm going to speak for all men here, Bert, right? But as men, so much of what we do and what we are is like in chase of having sex or wanting sex or because of sex. I can't imagine something that I enjoy so much, something that I chase so often, something that I love so much, being a painful experience for myself.
Better to have a short life that is full of what you like doing than a long life spent in a miserable way.
Hey. Welcome back, you guys. Thank you very much for joining us for another nursing news. So this week, two of us doing the nursing news. Again, we have Tina on. Thank you very much for joining me, Tina.
Thanks for having me.
Of course. So Tina, if you guys don't know, is from Good Nurse, Bad Nurse. Fantastic podcast. You guys have to go check it out. If you follow me on anything, you do know that I do Good Nurse, Bad Nurse all the goddamn time. But let's just jump right to I got so much to talk about, so much to say. We got stories up the wazoo, okay? So let me give you a quick rundown of what we're going to go through today. So we're going to talk about a mom that got paralyzed after having her first child. Crazy story, extremely crazy story. And Tina was the one that brought that crazy story to me. So I'm excited to talk about that. We're going to talk about mental illness and homelessness, specifically in California. We're going to talk about who won the Nobel Prize in medicine, endometriosis. And at the end of the news today, we're going to talk about a few personal things, especially about how I am finally going to do my travel nursing job, which starts from a week from now. So this is exciting stuff. If you guys have been watching me, so before we just jump into the news, if you guys have been keeping up with me, I got to let you know a few things, all right? So I tried to settle down because if you followed me or you listened to my podcast, shit was all over the place, right? I would drop 3 episodes in one day and then I wouldn't drop anything for months. So I tried to settle things down. Every Sunday, you'll get the Everyday Hero Show. Every Wednesday, you'll get the nursing news. I'm recording this Monday, the 10/7 right now. It's October 7th. So if Trump gets impeached tomorrow or the day after, it's not going to be in the nursing news, but it will be there sooner or later. That's announcement number 1. Number 2, I want everybody, if you want to shoot me a story that you want me to cover, if you want to have a quick conversation with me, if you want to just post or look at some funny memes and post nursing stuff, join our Facebook group, my Facebook group. It's called Nurses Are Human Too. You can find it, type it in, you'll find it. Some good things. And then last announcement before we start, check out the last Everyday Hero show that I just dropped yesterday because it was Sunday. With Joyce Brise. She was my old professor. Fantastic interview. Loved it all the way through. I think you guys will really like it. We focused on that episode a lot on the nursing skills lab and on clinicals, which I know a lot of you nursing students have been asking. I hate skills lab. Oh my goodness, clinical is scary. My old professor helped walk us through. Oh, so Tina, how are you?
I'm good.
I know those are a lot of announcements, but I gotta get it out there, boo. I gotta get it out there. So let's jump on in. So, Tina, I'm gonna just introduce the story. Then you're gonna lead the way on this one because this one is had me feeling a whole bunch of ways: anger, sadness. Let's just talk about it. All right, so there's a mom, and this is in Australia. A mom was injected with skin cleanser instead of epidural, which left her paralyzed. Her name is Grace Wang, and her anesthetist mistakenly injected chlorhexidine, a skin cleansing fluid, instead of administrating an epidural during a routine injection of spinal anesthesia. The hospital has admitted complete fault, and Grace's case is the only one of its kind ever recorded. Tina, this story made me feel some type of way.
I really don't. I was talking about this with some people at work, and none of us can really figure out how this would have happened. Now, it did happen in Australia, as you said, so maybe there's some manufacturers of chlorhexidine there that package it differently, but I've never seen chlorhexidine packaged in such a way that you could mix it up with a medication that you would be drawing up to put into a patient.
Yeah.
I've never seen that before.
Exactly. That's what I was concerned by, because if you read all of these articles, and it said in the article that I read specifically that they had 2 canisters or just like cups or whatever you hold liquid in. They were both with clear liquid. But I'm confused at why they had the anesthesia in a bowl of liquid instead of a vial like every other medication, or a bag like every other medication in the world, right? So I can understand having the chlorhexidine in a bowl because you put it in the gauze and you have to put it on the patient to clean the area. But why would you also have medication all in a bowl like that? Well, that's how they said it. And just to tell you how bad the situation is, she suffered massive nerve damage. She also had 2 brain surgeries post giving birth to her first baby, 2 brain surgeries, and ended up paralyzed from the waist down. Grace recounts the sadness in her heart because she couldn't even physically hold her own son when she gave birth, which I think is the saddest thing. I cannot imagine as a parent, as a brand new parent, giving birth to my kid, seeing my wife give birth to a kid and her not having the opportunity to hold that baby. That is the saddest thing in all of the world.
Yeah, because that's definitely that initial contact. They talk about how important skin-to-skin contact is in the first few moments of life, in the first few hours. So, and just that bonding time, it's really sad. That is very sad. It's kind of scary when I think about, I remember having an epidural and being afraid that the needle was going to, hit my spine the wrong way and I was going to be paralyzed, because that's definitely a risk. It's one of the things that you sign when you sign the paper. You sign the consent saying, yes, I'll do this. I understand that there's a risk. I'm pretty sure that no one would have ever explained that you could accidentally, draw up a skin cleanser. I don't understand how, like you said, yes, I do understand how you could have sponges with a bowl of chlorhexidine or container with chlorhexidine in it because you're prepping the skin in the area. But I definitely don't understand that same type of container containing whatever medicine was going into that epidural. It just doesn't make sense to me. It's hard for me to just wrap my head around that at all.
Yeah. So the thing that kills me, right? So I know that, and you're right. So you have to sign the paperwork that says, yeah, this might happen. You might hit a nerve putting in the needle, right? And that is altogether a scary process, right? But you're right. There's no way in hell in any birthing, labor and delivery unit ever in the history of labor and delivery is there a section when you're signing the release form to get epidural that says we might accidentally draw up the wrong medication. So I'm happy, number one, that the hospital took full blame. But moving forward, understand, ladies and gentlemen, this is her first child. This is the first baby she's had. She is super excited. You go in the hospital, and I say this every time I talk about labor and delivery, it's the one place, the one hospital visit where you expect good things, good outcomes, where you're there for a good reason, good for all good things. And for this to happen, yes, having a miscarriage is the saddest thing in the world. But for this to happen is this is... How can you? She had brain surgery after giving birth. She couldn't hold on to a baby, and she will never be able to play with her baby ever because she's paralyzed from the waist down. This is the worst thing ever. So obviously the hospital is going to be paying some fines. I don't know what the lawsuit is, if there is a follow-up to the story, but it seems like this hospital specifically is taking full fault and is willing and able to pay for all of what is needed to be paid for. But that's not the issue. The money isn't the issue. It's the fact that she is paralyzed from the waist down for forever. There's no reversing this issue. Do you think that, important question, Tina, does this doctor, anesthetist, do they need to lose their license, or is this an accident and we're looking at the big picture? Because I know people have a hard time. I know the reason I'm asking you is because you're a Mrs. Hardcore with the nurse with the vecuronium, right? So I need to know your perspective on this. Should this anesthetist lose his or her license due to this insane mistake?
I guess I would want to know more specifically exactly how everything happened. So is this something that's normal for them to have chlorhexidine in a container that could be mixed up with medication? Is this something that this nurse anesthetist, was it a nurse anesthetist or an anesthesiologist?
I think it was an anesthesiologist.
Okay. So was it something, basically hospital policy or very routine for the whoever it was performing this to do it this way, and therefore made it easier for them to make this mistake? Or is it something that this, I mean, whose fault was it? Who put them so close together? Who was being so reckless? And so it's very sloppy, and it was very reckless. Whoever decided to do this and put them together, is this something they just did for years, and this is just the first time that this happened? Because it's extremely shocking to me that it could have possibly happened, and it almost seems like there had to be some processes that were not in place, and somehow something was messed up with the way things were done at the hospital.
So I'm going to hold you to this, Tina, because I need an answer from you. Look, listen. Let's pretend that this is policy, that this is how they regularly do it, that they have these bowls of medication next to these bowls of chlorhexidine. Do you think that this anesthetist needs to lose his or her license and lose their job?
No, I don't think so. I am a firm believer in allowing people to make mistakes, and in just culture, learning from those mistakes. Definitely having some sort of repercussions for it, because it's got, somehow someone has to definitely own up to it. You're saying the hospital is taking the blame for it. So, but I think that everyone who is at fault needs to learn from the mistake. But I just don't believe that
firing one person.
I know, and it's devastating. And I don't think that because of the outcome, and this was really hard, because when it comes to certain jobs that you decide you're going to do, you do have to realize that you have someone's life in your hands. You have someone's, they're obviously her ability to walk, her ability to hold her baby. You are taking on a huge responsibility. So for you to be reckless with that and not taking it so seriously that you could do something like this, I don't know. I have to say, if this is the first time anything like this has happened, and it's clear that this was just a flaw in the process of the way things were done, I don't think they should lose their license necessarily. Maybe suspension or something like that.
Yeah. So I am in total agreement with you. So I know, like, this is, and like, especially in the healthcare, and you see this all the time in the healthcare field, where like things are put online, where people make mistakes in healthcare, which lead to horrible situations like this. And it makes me really sad inside to see how nurses, healthcare providers, doctors, everyone in healthcare on Facebook, on the internet, be like, oh my goodness, what a horrible nurse, what a horrible anesthetist, what a horrible person, fire them, they need to lose their license, they need to be in jail. I'm like, are you serious? Like, my first reaction is, why did that happen? Just like you said, is it policy? Number one, you're right. If this is policy, this is a horrible policy, horrible protocol that needs to change immediately. There needs to be a long-term, like, just education for the full-on labor and delivery unit, for the anesthetists, all of it. There needs to be education, and policy needs to change if that is policy. If it isn't policy, and it was just that specific anesthetist or the nurse that set up the medication that way or whatever, those two need to be educated on that. But it is an accident. If it's malice behind the accident, that's when I think firing is when you need to start having that conversation. But it's very obvious that it was an accident. It doesn't seem like someone meant to do this on purpose. But I agree with you 1,000%. It is a rough situation. And when you pick a job like nursing, when you pick a job in healthcare, even like being a law enforcement, like police officers, you have other people's lives in your hand. So when shit happens, but we also have to look at the bigger picture and not the very specific, just that one person that did that accident. But yeah, it's a really sad story. I hope the best for Grace Wang, but this is just like the worst thing that could happen after having your first baby. All right, moving on to the second story of the day. So let's talk about this homelessness. We know that there's homelessness blowing up throughout this entire country, but we're going to focus here in California today. So the Los Angeles Homeless Service Authority did a study on how many homeless people are suffering from mental disorders, substance abuse, and physical disabilities. Spoiler alert, those numbers in the study that they originally did were super low. I don't know why they cheated. I don't know what to say. Let me give you some more information before I start getting pissed off at this Homeless Service Authority, okay? The Times, because those numbers were so low and everyone was super suspicious of those numbers, the LA Times decided to do their own study, and they examined more than 4,000 questionnaires and found that about 76% of individuals living outside on the street reported being or were observed to be affected by mental illness, substance abuse, poor health, or a physical disability. Okay, and just to give you guys a reference, so this the LA Times found that 76% of individuals had one of those issues or multiple of those issues. The Los Angeles Homeless Service Authority originally said only 26% of people were had any of those issues, which is a very big difference. So 26% versus 76% is huge. I don't know why they decided to do that, but at the same time, when you read that stat, when I just told you they were observed to be affected by mental illness, I don't know how I feel about that. So I understand when someone self-reports, yes, I have mental disorders, mental illness, and I'm out on the street, I'm homeless. But how does someone observe someone to have a mental illness? I get a little iffy about that just because you start wanting to stereotype people. You start wanting to say because someone's out on the street and they shitting on the street, maybe they don't have a place to go to the bathroom. Maybe they're sleeping on the street and they look really dirty. You might think that they have mental disorder or mental illness, but that's just because they have nowhere to take a shower. So I get a little iffy on the issue of observing people and thinking that they have a mental illness and then charting it in the census as if they actually do have a mental illness. But that's a different question for a different day. Let me give you guys a little more information. So individually, substance abuse affects 46% of those living on the streets, more than 3 times the rate previously reported. And mental illness, including post-traumatic stress disorder, affects 51% of those living on the streets, according to the analysis. Tina, are you surprised by any of these numbers?
Well, I was initially surprised by the low number as you were from that initial study that you were talking about.
Yes.
Not because I've done any sort of research myself, but just because of what I do. I have observed myself, people who are homeless coming into the hospital, and because we don't have any resources for people with mental health issues, we have nothing. They have nothing. They have nowhere to go. All of the institutions have been shut down because our government offers no assistance whatsoever for people who are suffering from mental health problems. So it's horrible, but it's obvious that it's an issue where I live because I see a lot of patients who do have mental health problems come into the hospital, and they're only there because of their mental health issues. There's not really a medical issue going on other than, their meds. They haven't been taking their medications. They're in some sort of an exacerbation of whatever the problem is that they have, and there are no alternatives. They go back and forth many times between jail and the hospital and the street, jail, hospital, the street. It's just that's just the cycle of their life.
I love that you said that, because in the beginning, I did preface this by saying, yes, homelessness is at large in the United States horrible and has been getting worse every single year for at least the past 5 years, maybe even the past decade. But you're right. In every major city in this country, it's a constant revolving door of homeless people coming into these hospitals because they have nowhere to stay, and that's why I think talking to healthcare providers in this specific situation should be like your number one go-to, because you very quickly learn that these homeless people learn to just say that I have chest pain just so they can have a meal, just so they can have a bed, just so they can take a nap in somewhere that's sheltered. And it's scary. The reason California has an insane amount of homelessness is because the weather is so good, because you can stay outside and live outside and not freeze to death or die of heat stroke. So California is a great place. California is a better place to be homeless than a lot of other states. So seeing these numbers, you're right. I wasn't surprised by the actual numbers, by these most recent numbers from the study done by the LA Times. And I think you're right. It's kind of obvious, especially if you work in healthcare, because all of these homeless people you see come in, even if they do complain of a comorbidity, diabetes, whatever the other comorbidity is, you see time after time after time after time, each and every single one of these patients, they do indeed have some kind of mental disorder, substance abuse, all of the above, usually, right? And then UCLA also did a study, and they found that among those who had been homeless for more than 3 years, 92% had a physical health condition, anything from cancer to an abscess. This is crazy, crazy, crazy. But I did want to make a note here. And obviously, I just said it is obvious to us as healthcare providers that we're seeing people come in and they have mental illnesses. But this is something that I really want to focus on, just make a note of, because I don't want this stereotype to be out there, right? Many people had an underlying issue that was worsened by homelessness. So it's not once you become homeless, you develop a mental illness. Homelessness doesn't lead to mental illness. It can exacerbate the issue. It can make it worse. And a lot of people who have an underlying issue of mental illness or substance abuse or physical comorbidity, whatever, gets worsened by the fact that they don't have any home, that they don't have any income, which is obvious because they don't have any resources. Remember, homelessness does not cause mental disorders or substance abuse. I just want to make sure that y'all understand that's what I'm saying. We see a lot of homeless people with those issues, but it does not cause substance abuse or mental disorders. I know that people, it's easy to make stereotypes, especially when they're homeless, but I just want to make sure that we are all aware of that situation.
Well, I do think that there are certain life events that can trigger mental health disorders. So there could be some underlying mental health issues, some underlying problems that haven't really surfaced yet. And when someone goes through a really stressful time, like losing a job, going through a divorce, death of a loved one, they go through something like that leads them down, kind of spiraling downward, and then that can trigger them to start dealing with mental health issues that they maybe weren't even aware that were always there. They just hadn't surfaced yet.
Exactly. And a big one for that is you see a lot of people who, a lot of veterans who are homeless because they're dealing with that exact issue, right? They come back from serving for this country. They've been in active war situations. They can't deal with that at home. They can't get a stick with a job. They can't pay their bills, and they ended up losing their job. And yes, so they came back with PTSD. They're struggling from PTSD, and because of the PTSD, they can't keep their home, which means they end up being homeless. And that is same thing for everything, right? You start using drugs, you use all your money to buy drugs, you already are substance abusing drugs, and because you're using all your money towards that, you can't keep your home, you can't keep your car, you can't keep a job, and you end up being homeless, and that's how it works. So just please, it's hard to say, it sucks to say that a lot of homeless people are mentally ill, but I just don't want that stereotype to be there, right? I'm struggling to I just really badly want to make sure that you guys are all aware that I'm not pushing that stereotype. I'm just letting you know the actual facts and the actual numbers. So this next story is going to be a little quicker because this next story, I don't even know the details to, but I think it's important as a nurse, as a healthcare provider, to let y'all know who won the Nobel Prize for Medicine. So it was jointly awarded to William Kaelin Jr., Sir Peter Ratcliffe, by the way, Tina, love that name, and Greg Semenza. So the Nobel Prize for Medicine was awarded, and I literally just copied and pasted this from the article that I got this information from, but they were quoted of saying, the importance of oxygen has long been established, but the committee explained but how cells adapt to changes in its levels remained unknown. So this was really surprising to me, Tina, because as a nurse, as a healthcare provider, as someone who enjoys science and chemistry and all that stuff, we know super basic information when it comes to we know that cells need oxygen and human beings need oxygen, right? But that little detail, how cells adapted the changes of levels in oxygen, I think that was the reason they got the Nobel Prize, because we don't know how cells adapt when you're in the gym and you need more oxygen, or when you're like, I watched the details. I'll leave the link in below where they explain the Nobel Prize, but I loved how they explained it. And I think it's super cool that in 2019, you can win a Nobel Prize for something as simple as explaining how oxygen works in the body. Right?
I don't know how simple it is, but
yeah.
I tried to read the article and I was like, whatever.
Exactly. And that's why I think it's super. And I just wanted to let you guys, I'm in medicine. We're all in medicine. I wanted to let you guys know. So the Nobel Committee said that the trio's discoveries have paved the way for promising new strategies to fight anemia, cancer, and many other diseases. Randall Johnson, Prize Committee member, described the trio's work as a textbook discovery. This is something basic biology students will be learning about when they study at age 12 or 13 or even younger biology and learn the fundamental ways cells work. This is basic aspect of how a cell works. And from that standpoint alone, it is a very exciting thing. So just like I said, I think anything that you discover that is taught when you're a really young kid or is taught universally should deserve some kind of prize. So if you figure out something that they teach every single student that ever graduates high school, you deserve something special. If it ends up in a textbook for all high school students, congratulations, you did something special. At least how I believe, right? It's at least how I believe.
Yeah, I agree with that. One part of the articles, just I guess they were trying to sort of explain it in a way that we could maybe understand it. It says, if you think of the main causes of death in the U.S., 3 out of the 5 are related to a lack of oxygen. So yes. Heart attack, stroke, respiratory disease. So I guess what he's saying is understanding how the body senses and responds to low oxygen is fundamental to all of these diseases is what that's how they explained it in that article. So
exactly. And I think it's good. So I mean, who knows if we get to a time where get to a place where this knowledge, this information, this finding allows us to play with medication that can stifle that process of heart disease, stroke, all of that stuff. This is groundbreaking work, right? So I don't know how they go about picking Nobel Prizes, but I think they did a good job with this one, right? Now, Tina, do you know if a nurse has ever won a Nobel Prize for medicine? Is that a thing? Do you know if that's ever happened?
I don't think so. Because wouldn't they need to be a medical doctor?
I have no idea. I know that DNPs do research, so, and that's why the only reason I bring that up is because I had a couple of doctor NPs, and they both of them did research, and it's a big part of what they do, and they love doing it. So I was like, maybe a nurse can do it. I do know that there have been a couple of nurses that has won the Nobel Peace Prize for doing like Mother Teresa type shit, but like I would love to see one day a nurse being awarded. And if a nurse has, please let me know in the comments. I think I just wanted to let y'all know, Nobel Prize winner for this year. All right, moving on. And I love this story because Sherlock Holmes, and I thought maybe Tina would enjoy this because, I don't know, it's just I like these stories, these happy-go-lucky stories that just don't get enough coverage, all right? So there's a 97-year-old woman with dementia that went missing, all right? Cool, amazing ending. Don't worry, good things happen. 4 kids banded together to find this lady. Let me tell you the details, right? So the Roseville Police Department asked for the public's help in locating Glenetta Belford on Monday, this past Monday. Police said Belford has dementia and is mostly nonverbal and has been known to hide and hunker down in whatever location she loses herself in. Logan Hultman, a 10-year-old, told USA Today that his friends McKenna Rogers and Hope Claiborne were playing when they heard police in a helicopter asking, I don't even know how they heard the police in a helicopter, but they heard police in a helicopter asking for help, looking for this missing woman. They grabbed Hope's younger brother, so it was 4 of them. This is some Stranger Things type situation. Caston Claiborne and Logan hopped on their bikes and started searching the park neighborhood and near Cooley Middle School. Police said that they were overwhelmed by the number of residents who helped look for Belford, including the junior detectives who eventually located her. Tina, these are the happy-go-lucky stories that I absolutely love. but I have a few questions for you.
Mhm.
How much outdoors time do you allow your kids? Did you allow your kids on their own? Because I feel like in 2019, no kids are allowed to be outside without parental guidance. And I kind of hate it.
Yeah.
Were your kids outside by themselves doing their own things with the kids in the neighborhood?
Well, of course, it depends on how old they are as well.
Of course, of course.
These kids are what, 10, around 10?
Yeah, they were 10, but they also had someone as younger. They think the younger brother was like 6. So like from the ages of 6 to like 11, 12 years old. Would you let your kids be outside, no parents?
Outside in my yard where I knew where they were? No, definitely not riding around on bicycles.
Are you serious? See, this is what I'm talking about. Look, these kids saved an older lady. Are you really not going to let your kids go and explore the neighborhood to save this old lady?
Nope. Do you want to look up child murders and kidnappings? Just Google it. That's why.
See, this is why I wanted to talk to you about this, right? Because you're a parent and you understand it, and you're on the other side, so you're not afraid of your kids getting lost. Not because they're much older, but right. But like Tina, you really, like, as a kid, you were out there doing your own thing, right? You remember, you survived it. There was no issues with you.
I did, but do you want to talk about the children from the 60s and 70s who were kidnapped and murdered? Because those kids aren't here to say that they survived it.
Touche. But if you look at just the raw number, okay, look, all right, I'm going to hop off. But what I am going to say is, to those parents who do trust their kids to go out there, especially if you're in a group, if you're by yourself, maybe, I don't even know. Like, I just don't see any kids ever being outside riding their bikes without a parent around. And I'm a little concerned, Tina. I feel like maybe this is why these kids, myself included, are a little soft, because we always have a parent around. We always had an adult around to always fix all our little problems. If we fell down, there was someone with the Band-Aid right there for us. If we got upset or in a fight with another kid, there was always an adult to break things up. No one got them fisticuffs anymore. I'm just saying, a little old school kids, let the kids be kids and let them figure it out for themselves. I think a little bit of that is helpful. And they found this old lady, which I absolutely love.
Oh, I love that too. I love that they found her. Although it's a little scary if you think about like movies like It and and like the old lady. I think these little kids on their bicycles.
Yes.
I don't know.
I hear you. All right. So some more good news. And the reason I'm talking all about these kids is because I'll tell you afterwards, but some more good news. So a NICU graduates reunite with life-saving caretakers at Hillcrest Hospital. On Sunday afternoon, the hospital invited NICU graduates to come to the hospital dressed up as their favorite superhero for a very special reunion. The so-called miracle preemies reunited with medical providers who helped bring them the world and gave them life-saving care. So this, if you're confused at what I'm talking about, there's this bunch at this hospital, Hillcrest Hospital. A lot of these preemie kids who ended up were born premature, and they had to stay in the NICU, and they had tubes in them, and they were in there for weeks, and they were in there for months, or substance abuse, or whatever the reason these NICU babies needed to be in the NICU. 2 years afterwards, this hospital had a reunion, inviting all of these babies back, dressed as their favorite superhero, and they had ponies there, and they had snacks there, and they had a photo booth there, and all of the caretakers, the doctors, the nurses, and all of the preemies were reunited. And Tina, I absolutely love this story. I love the story. And I have to say, Tina, I don't think we do enough of this at all. And I feel like if we did more of this, I just took one of my little sisters to their yearly checkup, and they are so scared of the hospital. And like, as a healthcare provider, I hate that these kids are so scared of the hospital. And I remember being so scared of the hospital because I don't have any good memories of the hospital at all, full stop, period. And I have a lot of family members that work in healthcare. And I just feel like without situations like this, without having some good memory or some good a reason to go to the hospital, you will never want to go to the hospital.
Well, that's true. I guess the problem with that, though, also working in hospitals, sometimes I don't necessarily like seeing children come into the hospital if they don't need to be there because they are exposed to germs. Sorry, it's that protective part of me coming out again, but that scares me a little. But having said that, something like this where we have this at our hospital covered area out front where we have things like a farmer's market, things like that, little gatherings. I don't know. I feel like an area like that's in sort of a common area, you could do things like this, and that way you could bring, kids in, teaching them about hand hygiene and how important it is, and teaching them about germs and sick people and all of that stuff, and what healthcare providers do. I do think it's important. I really do, because a lot of people get to be adults and really don't have any idea what nurses do in hospitals. A lot of people, their only exposure at all to nurses are when they go to their primary care, and the nurse is maybe someone who comes in and just sort of checks them in and takes their vitals, maybe gives some shots, and sometimes those aren't even nurses, but we assume that they're nurses. Sometimes they're medical assistants or something like that, but a lot of people think that's what nurses do. They have no idea the responsibility that nurses really have.
Exactly. And you're a mother, you're a nurse through and through. Oh my goodness, watch out for the germs. And I'm with you, and I believe you. But I also agree with you when you say that if there is a safe area, if you are doing a celebration, if you are having an education type of community thing around the hospital, around healthcare providers, I think it's very important. Or even just have healthcare providers go to high schools. Even have something just as simple as that. My whole thing is, I can't remember. I'm a nurse. I have healthcare providers in my family, and I can't remember I don't have a good memory of going to the hospital, right? Maybe I got a lollipop after one of my checkups, but it's not a good memory for me. Like, a good memory for me is going there dressed up in my favorite superhero outfit, taking pictures, petting some ponies. That is a good memory, right? So I'm super happy, and I really, really, really hope that other hospitals start to take this. Just to close the story out, I want to let you know that there were more than 200 children in attendance to this celebration, to this reunion Sunday, that were born 2 years prior to the celebration, and they've been doing this every 2 years for 15 years. Hillcrest Hospital, you guys know what's up, and you guys know how to. I don't know. That's a very community-based care that you learn about in nursing school, and you think about it, but I've never seen any community-based healthcare at all since being a nurse. So when I see stories like this, I'm like, yes, we need an insane amount more of hospitals and healthcare providers like this. Hillcrest Hospital, you guys are fantastic. Hope to one day work in a place like that. All right, so now we're gonna have to switch to some sad news. This is as sad as it is very informative, and I think it's super important that we talk about these situations, okay? So this story is about sex and how sex can be very uncomfortable for people who have endometriosis. It's a really insane, horrible affliction that someone can have. And this story, we're going to start out with Holly. She is one of 1.5 million women in the UK who have endometriosis. It occurs when tissue similar to the lining of the womb grows in places like the ovaries and the fallopian tubes, meaning fertility can be affected. And not only fertility can be affected, your sex life can also be affected. In her case, as with many others, it can also cause excruciating flare-ups of pain during and after sex. Holly says, it's not just the fact that you might not be able to conceive and have kids or the family you want. It also affects your sex life. It makes me feel like I'm a failure and not a good girlfriend / wife / partner, whatever you want to call yourself. Tina, so you learn about endometriosis, you learn about these chronic illnesses, these diseases in nursing school. And sometimes, especially if you don't work in L&D or in women's health, you kind of forget about these things. But there are millions. I just said 1.5 million women just in the UK that are suffering from endometriosis. And they are having, not just dealing with the fact that they might not be able to have children, they are dealing with the fact that it is painful to have sex. As a man, I can't even imagine what this would mean for me I don't even know. Okay, let me just you can just tell me how you feel about this, because this okay, go ahead. How do you feel about the situation?
Well, I don't really understand a lot about endometriosis, but I have had a lot of friends who have talked about having this, and I definitely, it is a debilitating disease that affects their whole life, affects sometimes their ability to just do regular everyday things like clean the house and work, and because it's so debilitating and painful. So I guess another aspect of that would be your sex life. If you think about where it grows, it can get so overgrown that it grows all over.
Yes.
And I don't really, like I said, I don't know a whole lot about it. This is not the kind of nursing that I do, but and I've never experienced it myself, so I'm not real familiar with it. I know what it is, and I do know that there are a lot of women that suffer from this. I wish that there was more research being done for this, because I feel like this has been around a long time, and I'm surprised that there isn't more, haven't been more advances in this area to where there can be some relief, but it seems like there isn't a whole lot that can be done.
No, I hear you. And I agree. And not a lot of people do know a lot about endometriosis. So let me give you a little more details and an example from another lady who was in this article, this BBC article that I read through. So surgery to remove visible patches of endometriosis tissue can sometimes help, but there are no guarantees, and it comes with a risk of complications, which can include bruising around the womb, and in less common but more serious cases, organ damage, which is super, super intense. I'm going to just talk to you about another lady who also gave her perspective on her how she deals and has been dealing with endometriosis. So another lady, her name is Sophie in the article, but it's not her real name because she didn't want to give it out, suffered such extreme pain, she found herself unable to have sex with her partner. And she was quoted by saying, endometriosis ruined my relationship. In the bedroom, I just couldn't do it. I didn't know what the pain was, and I felt like I wasn't being taken seriously. It was excruciating, and it just didn't, and he just didn't understand it. In the end, he slept with other people. Holy shit, right? Now I'm not actively seeking a relationship because I'm worried about sex and not being able to do it. So I said in the beginning, as a man, I don't know how I would take the situation, because I think I'm going to speak for all men here, Bert, right? But as men, so much of what we do and what we are is in chase of having sex or wanting sex or because of sex. I can't imagine something that I enjoy so much, something that I chase so often, something that I love so much, being a painful experience for myself. That would, if you want to destroy that's why erectile dysfunction, and that's not a painful situation. That's just, you can't get your penis hard, right? And that, to men, it's like the ultimate, manhood. It takes your manhood out of you, right? So I can't imagine sex being a painful experience. And then to put it on, and for her to say that her partner ended up sleeping with someone else and they just didn't understand that she was in excruciating pain. And every time she wanted to please her partner, she had to choose between me feeling pain and pleasing my partner, or me not being in pain or still being in pain. Not even, it's not just when you're having sex, but it's just a crazy situation to me. An insane, crazy situation to me. So I did a little bit more research about this, and I found out that a common thing to that relieves all of the pain, relieves endometriosis, is getting an entire hysterectomy. But that is super, super, super intense, right? So a hysterectomy, for those who don't know, is getting rid of everything. Right? I mean, there's no chance. It's not like maybe you can have a baby in the future. No, you're done. That's your entire womb coming out of you, right? That's a full hysterectomy, and that takes care of endometriosis. But that's the decision that these ladies have to make. Do I lose my entire womb and not suffer from endometriosis, or try to suffer through endometriosis and try to have children? It is a crazy, crazy, crazy thing. And again, it's just 1.5 million in the UK, so you can imagine what that means for the world. I'm sorry I don't have those numbers, but this is just a scary thing. And like, you learn about these things every day, and you walking down the street, you're in the hospital every day, you probably know hundreds of people that are dealing with this, and you just have no idea. So my heart goes out to every single one of these ladies, every single person that is dealing with endometriosis. It's just a scary, chronic, horrible illness. All right. Is this, let's see. Oh, yeah. So the last story of the day, and I know, I'm sorry, I should have shuffled this. Oh, no, this is a good story. Well, this is the nurse of the week. I'm so sorry. I know I hooked myself up. So this is the nurse of the week, favorite story of the week, every single week. And this is about an oncology nurse with breast cancer that uses her diagnosis to connect with her patients. And for those who are watching this on the, who are not, if you're listening to this on the podcast, the reason I chose this lady is because when I was scrolling down the news feed to find some stories of the day, she was wearing a pink wig. And I was like, what is this nurse doing with this pink wig? But for those who are watching the edited version, you'll see a picture up on the screen. I love when nurses and just healthcare providers do things like this. So her name is Angela Ringer. And just days after the birth of her first grandchild, Ringer was diagnosed with triple negative breast cancer, which is a more aggressive form of the disease. The diagnosis floored her because she is, like I said, an oncology nurse. I mean, this is what she does on the daily, every single day. She's taking care of patients who have breast cancer and other forms of cancer, and she never thought it would be her, but she was diagnosed with this. She said, throughout the troubling journey, Ringer said she tried to remain positive and dressed in more pink. Quoted of saying, I didn't want to be sad, poor cancer patient. I wanted to do it with as much style as I could, so I blinged it up. That's my lady. That's my nurse. That's the kind of lady I like. She put on some bright lipstick, earrings, the brighter the better, she says, scarf, and the pink wig, Ringer said. I love the story. God damn it, I love the story.
Well, I think it's wonderful when someone takes something as dark and negative as a breast cancer diagnosis, especially, the aggressive form of breast cancer is something that usually takes someone's life within just a few months. It sort of sneaks up on them. You have no idea it's there, and then all of a sudden it's there, and by the time they know it, it's too late. So I don't know if that was the case for her or not, but I love that she's a nurse, so she understood the risks and she understood the severity of it. And I love that she just took that, and rather than, if you have a diagnosis like this, it's something so horrible, you have every right in the world to have pity party, feel sorry for yourself, wallow in your misery. I would never judge you for doing that. That's whatever you need to do. But if you're able to overcome that somehow and just turn it into something good to help other people and pretty much just get the most you can out of whatever time you have, then I think that's wonderful. And what a wonderful example she's been for other people.
I love these stories. And the most recent everyday hero that I just interviewed also had breast cancer. And she came out on the other side as well. And being a healthcare provider and being one of these patients, I don't want to say it's easier. At least what she told me was it's easier because she knew what to expect in all of these things. But even knowing what to expect, and you better believe that Nurse Ringer knew what to expect. She worked on a cancer. She worked on an oncology floor, right? But Joyce, the last everyday hero I interviewed, she said that even knowing literally every step that was going to go it's still a scary process. So for her to be so positive about this and make it so public and be that shining star, she doesn't know what outcome is going to happen. She doesn't know if she was going to get through the process, but she decided, I don't know what's going to happen. I can't control what's going to happen, but I can control how I go through the process. And she did so looking fantastic. She did so in the best way possible. God damn it, I love these stories. Nurse of the Week, you deserve so much more than Nurse of the Week. You are inspiration to so many, Nurse Ringer. I love it. I love it. I love it. That's the end of the nursing news. If you guys remember, listen to me. Tina is amazing human beings for joining me and doing the nursing news with me. Tina, why don't you tell the folks where they can find you?
You can find me at our website at goodnursebadnurse.com. You can find us on any of the podcast platforms like Stitcher, iTunes, any Android device. Wherever you listen to podcasts, we're on there. And, of course, we're on Facebook and Instagram at GNBN Podcast or Good Nurse Bad Nurse.
Love it. You guys got to go listen to it. I'm telling you, fantastic podcast. Absolutely love it. I am a co-host on it for many, many episodes. So enjoy listening to me as well as listening to Tina and all these very good and some very bad and sometimes good nurses. I love Good Nurse Bad Nurse. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.